My name is Dr. Scott Gilbert. I'm a urologic oncologist here at the University of Florida. I also serve as medical director for the urologic oncology program. I obtained my medical degree from Columbia University College of Physicians and Surgeons, and then stayed on for residency at Columbia as well. Following residency, I went to the University of Michigan for a 3-year fellowship in both urologic oncology and health services research. As a urologic oncologist, I focus on patients with urologic cancers such as prostate, kidney, bladder, and testis cancer, although the main focus of my clinical work is really in bladder cancer and testis cancer. Surgically, I perform both open traditional surgeries as well as laparoscopic and robotic-assisted surgeries. Some of the patients who come through our clinic also have had previous surgical attempts or treatment such as radiation therapy, and those patients tend to come to my clinic for salvage procedures when other treatments have failed. I also am a very strong proponent for multidisciplinary care, which dovetails into my role as medical director for our cancer program. So whenever possible, we try to manage patients with our colleagues, our medical oncology and radiation oncology colleagues, to provide sequenced care and the best chance for a good outcome. As a health services researcher, I spend a good portion of my week thinking about and studying how cancer services are provided to cancer patients across the state, as well as how patients do with outcomes following treatment. We have several studies ongoing at the University of Florida in conjunction with other institutions. One in prostate cancer, looking at statewide patterns for how prostate cancer is treated across Florida, and a second, a more focused study looking at patient-reported outcomes among patients undergoing cystectomy for bladder cancer. Both these studies have been ongoing for the past 2 years, and we're collecting data to better understand how patients are treated and how they do following treatment. And these research projects really dovetail well with our clinical work. Clinical work actually is a springboard, oftentimes, for the research projects. So some patients will ask why choose the University of Florida. I believe that patients' outcomes and their treatment is best when it's provided through a team, a multidisciplinary team. And that's how our program is built. We have structured our cancer program to allow patients to meet both with surgeons like me or medical oncologists and radiation oncologists, so that patients can get to the right physician and be prescribed the right treatment. I really believe that the multidisciplinary model for cancer care is the ultimate way to tackle the problems that cancer patients face. And at UF, we strive to provide that for every patient that comes through our doors.